Hello.
Hello, everyone. We are so excited to come to you live and share edition 3 of our flashcards. You guys, this is amazing, amazing stuff, and we are so pumped. Who do we have here with us?
Pumped. You have no idea, guys. We have been dying to share this news with you. This has been something that we've been working on and putting a lot of our love and attention towards, and we are just beyond thrilled to announce in the new year, 2023. Happy New Year, friends.
Yes, Happy New Year.
Our new edition.
Yep. So it's a perfect time to roll out our all new cards, edition 3 of all of our flashcards. And in particular, the star of today's show is this. This is our Ultimate Nursing School Survival Kit. And we are so excited to show what's inside this kit, to talk about all the different edition 3s of the flashcards. And we are giving away so much stuff tonight or today.
You have no idea. If you think that we are normally giving stuff away, like, this is above and beyond. We're so excited.
Totally. So some of the stuff we're going to give away one of these kits tonight, which has everything you need to be successful in nursing school, on your exams, and on the NCLEX. It's pretty much the ultimate kit to really help you succeed in nursing school. So we're going to give away an entire kit.
Look how big this is.
It's so
Look
pretty.
How cute it is.
For sure. And in addition to giving away an entire kit, we are also going to give away 11 individual flashcard decks in this live broadcast. Yeah, so they're over there behind Meris. Aren't they beautiful?
Look how cute they are.
They're beautiful. Oh my gosh. They are amazing. I can't wait to show you guys everything about it. So we're going to give away a kit. We're going to give away 11 individual flashcard decks. So if you have classmates in nursing school or friends who are in nursing school, you might want to text them or DM them to tell them to come on and join our live session so they can have a chance to win some flashcards as well.
And, because maybe if one of you wins like the ultimate bundle, you can share amongst yourselves and you can have your little study groups.
Totally. And for those of you who are site members, so members on leveluprn.com, you get a special discount off of all of our products. So this is a new offering that's recently been added to our membership site, available at leveluprn.com. And if you are a member, then you get discounts off of all of our products. So, and that includes our Ultimate Nursing School Survival Kit as well, and individual flashcards, flashcard decks, everything. So I just wanted to mention that for those of you, because I know we have lots of members. So definitely know that you will be getting an extra special discount if you're a member.
Yes. So if you are a member, you need to log into your membership portal to be able to get that discount. So it's not like you're not going to get like an email with a code or something like that. You need to log into your membership portal for that code to be able to work.
Totally. So let's talk about, I want to first talk about some of the key features of edition 3 of our flashcards. And then I will, we'll have you guys kind of comment and, I don't say register, but try to win one of our giveaways. So
yes. Before Cathy starts, I just want to say I've already seen comments about what are the differences, why I just got this one. Don't you worry. Please don't worry. We are going to answer all of those questions and more. So we've seen them. I promise you we will answer them. Don't you worry.
Totally. We're going to go through. So there are 11 decks in this Ultimate Nursing School Survival Kit. So when you get the kit, let me open my kit here so you can kind of see what it will look like. So I showed you the box it comes in. And me see if I can do this without dumping everything all over the place. This is how it comes to you. Okay, so it contains fundamentals, pediatrics, pharmacology, health assessment, lab values and ABG interpretation, clinical skills, nutrition, psychiatric mental health nursing, med-surg, maternity, EKG. So EKG is down here on its side because it's a little bigger because of all the rhythm strips that we've included.
Yeah, she's got to be a little bigger than everybody else.
Totally. And then the other thing this kit comes with is our on-the-go box. So this is amazing. This can fit like up to 40 cards, but 20 to 40 cards that you can take with you on the go. You can put it in your backpack. You can put it in your purse, whatever. And when you're sitting there at the doctor's office or between classes or I don't know where else, at the kid pickup line, those are all the places I took my flashcards when I was.
Yes.
Totally. So the kit comes with this little to go on the go box. And so the only way to get this box is with the kit. So that is what you can expect to see when your kit arrives to you in this awesome storage box.
And then you can put it up on your shelf and have it look so cute and aesthetic and make your study space look a little bit more adorable.
Totally. So let's get into like some of the features of the flashcards. Okay, we both have our farm up. So every individual deck that I showed you in the kit comes in its own individual box. And this box is super durable, super thick, super high quality, okay? And we are very particular about boxes over here, okay? So I can't stand boxes. Yeah, Meris knows I'm like, especially me, okay? So I'm intense about my boxes. So I don't like them thin, and I don't like it when the cards are all smushed in there such that you have to take them all out to find a card you are looking for. We, in particular, like deliberately left a little wiggle room here so that you can thumb through the cards and actually see the cards and find the card that you are looking for. So it's got that wiggle room on purpose, and the sides of the box are below the flashcards, so you can actually see the flashcards and thumb through them. They're not like hit recessed in the box. So,
and if you are a crazy person like I am, I loved our tabs so much. I loved that we could separate our deck sections. I loved all of that. But again, crazy person, very neurotic. I could not stand that the tabs would sometimes fall over or they would shift or something like that. These are full width tabs. So first of all, it comes like this. You don't have to put your tabs in yourself anymore. Now it comes in the box ready to go, but there's no shifting around of the tabs because they go the full width. And also, I don't know if you guys know this, this is my favorite thing. There's little pep talks on some of the tabs.
Oh yeah.
And not all of them, but this is like my favorite thing in the world because nursing school to me felt very isolating. I felt like nobody knew what I was going through. Nobody was on my side. We're on your side. We know what you're going through. We've been there, and we want, while you're studying, for you to come across a little pep talk and be like, "Aw, thanks, guys."
Totally. So some of you, like who said they bought the old, like our old set, if you bought recently, if you bought your cards within the last 60 days, reach out to our support, okay? support@leveluprn.com, and we'll try to help you on that, okay?
Yep,
so
I just put the email in the comments. So if you bought between November 4th and today, and you're like, hey, I really love edition 3, reach out to them, and they will be able to get you some hookup.
Okay. So we've got these full width tabs. Every flashcard deck comes with an index, so you can quickly look up any topics. It also comes with our Level Up RN learning system. So if you want to separate your cards based on how well you know the information, if it's new to you or if you're learning it or you leveled up, you can kind of separate your cards into different groupings that way if you want to do that.
Yes.
So that is included here at the back of each of the decks. So yeah, the boxes also look pretty amazing on the shelf, as you can see from Meris's. I don't have my shelf near where you can see. Yep, there we go.
Oh
Look
God.
how cute
And
those
it's
are.
just like, it's just so cute. I love that. This is like one of my things. Cathy and I, we meet all the time and we'll talk about different content and things like that. And she'll be like, hey, can you look at your, maternity cards and blah, blah, blah. And I'd be like, okay. And I would have to pick up my boxes, which had multiple decks in them. And I would never remember which deck was in which box. So I had to write it on the side. And then I have to like flick through and find what I'm talking about. Whereas this one, I can be like, maternity? Yeah, I got it. It's right here. So hugely helpful.
Totally.
Oh,
Totally.
look at
So
that.
they display nicely.
I'm a saw my purple scrubs. I want,
Oh yeah,
did you
pink,
guys
it matches our stuff now.
Did you notice that we match our stuff? So I'm matching our midterms box. And Cathy's matching the rest.
Totally. And let's talk about our flashcards too that are in there. So we talked about the boxes and how amazing the boxes are. And really boxes like matter a lot. So we made them amazing. I know you guys will love them. The flashcards, as always, are of very high quality. They're thick and durable. They have rounded edges now. They are glossy on the front and matte on the back. And they're matte on the back so that you can take little notes or highlight things as you want to when you're studying. Or if your professor says that you need to know an extra little something, you can write it directly on the card. Okay. And what other? So the big thing about Level Up RN flashcards and what Meris and I talk about a lot on these lives is that our flashcards are super consolidated. So they just contain the key information you need to know without all the fluff. So we're not trying to put a whole drug reference guide on one of our medication cards. We're not trying to put tons of information on a flashcard. We are really limiting it to the main things you need to know and that you are likely to get tested on in nursing school. So,
yep. Your time is precious. We don't want to waste any of it.
Totally. And you'll notice that with a lot of our cards, we have bold red text. That means that information, those facts are highly testable and something you will definitely want to focus on if you're getting ready for your exam. We also have our cool chicken hints throughout our flashcard decks. So these are fun, funny or silly ways to remember key information about a disorder, a medication, etc. So for those of you who have our current edition flashcards, you're familiar with our cool chicken hints. Our cool chicken here just got like a little upgrade. He's like a little cooler now, right? He's got the purple sunglasses.
And one of the things that we did for the like cool chicken and things like that, you may notice we left this border here on the side, and that way all of the icons can come out there so that they're not lost in the text of the flashcard. So you can very quickly at a glance look and say this one has a cool chicken hint or whatever it may be, and that way you're not hunting for it within the like text of the card itself.
Totally. All of our flashcards have been built by expert nurses and nurse educators who, write the tests, and also everything, you can trust the information on here. Everything is referenced and backed up by evidence-based practice and research. So, when you buy Level Up RN flashcards, that everything is going to be fully accurate and reliable for you.
Yes, and that's very important for your education in general. I just want to say is like you should expect and demand of your educational resources that they are updating their information based on the most current evidence-based practice. It drives me bonkers when I see textbooks that are being used by schools and they're like 3 editions behind. It's like, you got to get with it. That EBP matters, and we do our best to bring you not only what is testable, but also what the actual clinical practice is. So you'll see sometimes that we might reference something and say like, by the way. Like, you need to know this for your test, but in the real world, you may not do it that way. We try to give you that information so that you have the current evidence-based practice along with the information that you need to pass the exam. And so you should expect your educational resources to be updating their stuff with frequency, with a good amount of regularity, to be up to date with current best practice guidelines.
Totally. And we continually do this. This is a process that we do ongoing throughout the year. And if there's new information or some way we need to clarify anything, we make those changes on the cards right away.
Exactly.
The other thing, as many of you guys know, the other awesome thing about Level Up RN flashcards is that you can follow along with our YouTube videos. We have hundreds and hundreds of videos. So like with pharmacology, you can follow along with my videos and really reading the flashcards, hearing me talk about it, or hearing Meris talk about the information. If you're listening to one of her playlists, it really helps to cement the information so much better. So if you are a visual or auditory learner, really being able to hear those YouTube videos and also have that information at your fingertips to review through repetition is the thing that's going to really help you master this information and do so well in nursing school.
Oh yeah, absolutely. And we talked too about the fact that you want to be exposing yourself to multiple avenues of people saying the same thing in different ways. So yes, you probably heard all of this information in your lectures. Yes, you probably heard somebody talking to you about, preconception, things, concepts, all of that sort of stuff. And that's awesome. And that's super duper important. But what you need is to then hear somebody else talk about the same stuff in a slightly different way, because they might make something click for you. They may hit on something that you missed the first time. Recording lecture and listening to it back is great, but you're only hearing the same person say the same thing in the same way every single time. So our playlists allow you to expose yourself to different ways of hearing and learning that material, and then combine it with our flashcards, and you really have like a can't miss kind of concoction of studying there.
Totally. The other thing that's new with edition 3 is free shipping. So free shipping on any of the flashcards, or sets of flashcards. So free shipping, period, end of story, with 3rd edition flashcards. Also, with the purchase of any flashcard deck or multiple flashcard decks, you get a free month of membership on our site, leveluprn.com. So that's a pretty amazing perk as well. And if you aren't familiar with our membership has all of our core content without ads. It has our cram sessions. It has hundreds and hundreds of review questions, thanks to Meris. And it also has contact hours. So it's an amazing deal. Even if you had to pay for it, but it comes free for a month with the purchase of any flashcards. So definitely check that out.
Yes, and there's more coming on membership too. If you saw our membership live a couple of weeks ago, we told you about it, but this is just the start. There's so much more coming, so you definitely want to get in on the ground floor. Also, if you sign up for membership now, I believe you lock in your price for life for the $10 a month. So if you just want to become a member, you can. $10 a month is the price right now. You can sign up and lock in your membership, pay $10 a month for life of your membership, and everybody else will be paying $20. So go ahead and lock that in.
Totally. So we went through the 11 decks that are contained in the Ultimate Nursing School Survival Kit. For those of you who had the previous NCLEX pack, we used to have Pharm Basics and Pharm as separate decks. Those are together now in the same Pharmacology Edition 3.0 deck. And also in our previous edition flashcards, lab values and ABG interpretation used to be separate. Those are now together in the lab values deck. And we're going to go through each of the 11 decks and kind of give you an overview of what you can expect from those decks. But before we do that, I want to give you guys a chance to sign up to possibly win one of our flashcard decks or our Ultimate Nursing School Survival Kit. So like I said, we're giving away the 11 decks plus the kit. So you can only, couple rules here, because you got to listen carefully, because if you mess up these rules, then you get disqualified. Okay. You can only enter one time through this live. So only one time. If you enter more than once, then you will get disqualified. So definitely only enter one time. You have to be present to win. And if you win one of the prizes, then you can't win the other one. So only one prize per person. Is that all the rules? Am I forgetting anything,
That's
Meris?
all the rules.
Okay. And so we will announce a winner after we describe each of the 11 decks. And then at the end, we'll announce the winner of the Ultimate Nursing School Survival Kit. So if you would like to win a deck, and it will be a deck of your choice, right? So you can pick the one that you need. If you would like to win an individual deck or an Ultimate Nursing School Survival Kit, then in the comments one time, type in Ultimate Nursing School Survival Kit. Okay?
We gave him an essay this time.
I did. Ultimate. Is it too much? You guys can handle this. They can handle it, Meris. They have to remember 5 billion things in nursing school. Ultimate, see, look at all these people paying attention and following directions. Ultimate Nursing School Survival Kit. See, Meris doubted you, but I knew you could remember that.
I didn't doubt you. I just knew I knew your brains were full of nursing school information, and I didn't want to cram 4 extra words in.
Totally. Okay. So you guys do that. Enter one time only. Put that in the comments. And then Angelina, who's always here to like assist us, she's going to like take all the entries and pick random winners and let us know who the winner is. So I better have my phone
Angelina
on
is
here.
laughing
so
at me for laughing.
Yeah, so there's that. Okay, so let's go over some of the key features of each of the decks. So as I mentioned just a minute ago, Pharmacology Edition 3 comes with both pharmacology basics and medications sorted by body systems, okay? So in the pharmacology basics section, you can find information such as drug names, medication regulation, pharmacokinetics, antidotes. What else do we have here? Food drug interactions, as well as herb drug interactions, prescription abbreviations. I'm just like naming a bunch of the stuff that's in there.
Cards. We've got the like reference cards so that a lot of drugs are anticholinergic drugs. So we've got anticholinergic effects here. A lot of drugs cause bleeding. So we talk to you about bleeding precautions all in one place. A lot of drugs can lead to infection. So we talk about infection control in one place so that you have all of that information and you can study and know this is what a bleeding drug can do. This is what I need to know. This is what a drug that causes infection can do. This is what I need to know. So we have it in there.
So yeah, so that whole section is just kind of like helps you get a strong foundation for pharmacology before you learn specific meds. And then the second section is the medications by body system. So if you have our previous edition of pharmacology, it's roughly the same medications. There was like 3 or 4 medications we added, and like in the old edition, we had like a couple cards where we had multiple medications and we broke them out on 2 separate cards this time. But honestly, if you have our pharmacology second edition flashcards, it's roughly the same medications. Little different formatting. Let me grab a card.
While Cathy grabs that stuff, I want to tell you that that is the case for the majority of our flashcards here, is that everything from edition 2, if you have those cards, it's not like they're no good and you can't study with them anymore and you got to throw them away.
Right.
They are still going to serve you well. This is just the most up-to-date information for some things.
Totally. So what you can expect from each of the medication, drug class cards. So on the front, you'll find the name of the drug class. And then on the back, you will find indications for the drug, the mode of action. Sorry, I'm going to back up. The names of the drugs right there that fall within that class. So you will find the generic names of the medications at the top. Brand names can be found in the index. So in nursing school, as you guys know, yeah, there's a huge index which contains generic names, brand names, as well as drug classes. But really, the generic names are the most important ones that you need to know in nursing
like this
school.
card
So that's
right
what
here
we've
that she's
included
holding
here.
up, this is theophylline, right? But if for some reason you're in school and you're learning that it's Theo 24, it's right there. So theophylline is here, Theo 24, so that if you're looking for the brand name or the generic, don't worry, we have you covered. And of course, you can always use our searchable index online too, so that you can look up whatever it is that you need to if you happen to not be at your index.
All right. So with pharmacology, the thing that was frustrated me when I was in nursing school, and the thing I dislike about like really almost all other flashcards for pharmacology, is that they just put too much information on a card. It's like a drug reference guide, and I'm like, I don't need a drug reference guide. I need to know the key stuff I need to know about this medication, like the most important things. So that's what we do. We have the indications, the mode of action, the contraindications, the side effects. Certain medications have black box warnings, so we include those when applicable, and then nursing care and patient teaching. So this, the format of our farm cards changed a little bit just to be more in line with our other flashcards. So we specifically call out nursing care, patient teaching, etc., in separate sections on the card. So that's some of the key stuff with pharmacology. Did I miss anything else? Oh, and just like our previous deck, Level Up RN is all about the cool chicken hints and the silly ways to remember medications or side effects of medications. So you will, of course, find cool chicken hints throughout our pharmacology flashcard deck. So most medications in this deck have a cool chicken hint.
And we did our best to like go through and see if we could find ways to make them like more like more memorable. Yeah. God, wow. Okay. Or to come up with some new ones. So we did go through and try to, I mean, we know that these are the silly things that you remember on tests. We want to help that way. So we did add a bunch more and change some to be even better.
Totally. And like I mentioned before, we have a complete YouTube video playlist so that you can follow along while studying your cards, and that'll just help you learn that much more. So do we have a winner for our first giveaway? Okay, we do. So our first winner of a flashcard deck of your choice is Dove Love.
Yeah.
Dove Love. Yes. Okay. So, and I know they're here because they're asking questions. So perfect.
Grab
so Dove
you
Love is
a
our first winner.
flashcard set. So yes, Dove, you need to email support@LevelUpRN with your YouTube handle and let them know that you won one of the flashcards. It's support@leveluprn.com and let them know which one you would like, and they will get that out to you.
Totally. All right. Second deck that we are going to talk about is our lab values and ABG interpretation deck.
Yes.
So
this
Meris,
is like shockingly,
yeah,
this is actually like kind of low-key one of my favorites that we are putting out in edition 3, because this is the first lab value is the first flashcard deck that I ever helped Cathy with before I ever worked for Level Up. I reviewed lab values way back in the day, and so I feel some kinship with lab values. But I love the changes that we made to lab values because we did a couple of really important things. Whoa. One is we combined ABG interpretation with lab values, because ABG was a tiny, skinny little like 16 card deck or something like that. But really, ABG interpretation is a part of your lab values. So it belongs with lab values. The other thing, and this was something that drove me bonkers when I was in school, was I remember taking pediatrics and they expected me to know all of the pediatric lab values, but no, I couldn't actually find a source that went over what the pediatric lab values were. And so I was having to I didn't have a textbook that said ped lab values are these. So we did the hard work for you. And now there's a whole section here for pediatric lab values. And so I'm like really excited about that.
Totally. And for a lot of lab values, the adult and pediatric lab value ranges are the same, but there are key lab values where they are different. And those are the ones that we've included in this tab. Also, the
Yep.
first section includes our lab panels. So it describes each of like the common lab panels and what lab values are included in those panels. So
Yes.
we got lab
This is one of
panels.
my
Yeah.
Oh, sorry. I was just gonna say this is one of my pet peeves is that you learn things like, oh, carbamazepine can cause blood dyscrasias, so monitor their CBC. Okay, that's super cool. What's a CBC? Like, no one ever taught me this in nursing school. No one said, here's a CBC,
Yep.
here's what a BMP is, here's what are on the LFTs or anything like that. So we did that for you so that you, when you go to clinicals, when you start working as a nurse, you're at least familiar with what these panels are and where you can expect to find certain lab values. Because how frustrating is it to be told to monitor the CBC and not be told what a CBC is?
And not know what's included in there. Totally. So that's the first section is our lab panels. And then the second section, which is kind of the beefier section, are the adult lab values. The third is the pediatric lab values. And then we have ABG interpretation so that you can learn like what an ABG is, what are the components of an ABG, how you can interpret ABGs, and what are the causes, symptoms, and treatments of key acid-base imbalances. And then finally, there's like a section on other important ranges. So this includes things like intracranial pressure or intraocular pressure. So they're not lab values, but they're other important ranges that you definitely have to know in nursing school.
Yeah,
And
all
for
of
me,
these
I don't know.
cards tell you. Sorry, we're like lagging ever so slightly, but all of these cards tell you what the lab is. What does this mean? What is creatinine? Why do I care? It tells you what the expected range is. It gives you if we have a cool chicken hint or something, then we have that on there, and then it tells you what does it mean when it's down and what does it mean when it's up, if applicable, right? Like for instance, D-dimer. I just talked about this on TikTok today. D-dimer, if it's up, has a meaning. If it's down, it doesn't. So we don't necessarily talk about that. So you'll see that we have this all built out in here so that it's not only what is it and what's the range, but what does it mean if it's high or low? Right. What could be the cause? What might we anticipate? So that's super helpful. Again, you don't want to just memorize, you want to draw those connections.
Totally. I'm loving these comments, by the way, CD.
Me
I
too.
wish there was a level up RN nursing school. You know what? We think about that all the time. But anyway, yeah. So here's an example of like calcium, right? So we have a definition of what like calcium does in the body, what the expected range is, a little cool chicken hint for remembering that normal range, significance of decreased values of calcium and significance of increased values of calcium. And so you can find that type of information on these, each of these lab value flashcards. So just wanted to show you one there. Okay. So that is what you can expect. Yeah. So do we have a second winner?
We have a second winner. The winner of our second giveaway of a flashcard deck of your choice, edition 3, is going to be Ariana Lopez. So Ariana, email support@leveluprn.com with your handle. Let them know which flashcard deck you want, and we will get that out to you.
Okay. You guys ready for deck number 3 that we're going to talk about? This is Meris is actually working actively on building out a video playlist to go along with this deck. You've already done a cram course as part of our membership, haven't you? So that'll be coming to membership.
It's not live
really
yet, but it will be very soon. Yeah. So I know we don't have a lot to support you with health assessment right now, other than our cards and like our blog posts and stuff. But man, oh man, we revamped the cards. I just recorded a cram course. I'm recording core content videos for you. So definitely get in on that membership if you haven't already. And if not, if you want to just wait for it to hit YouTube for the core content, those will be there soon too.
Totally. So this deck is intended to help you master your head to toe assessment, to understand the components of your assessment, the order of the assessment, to understand the expected findings and the unexpected findings as well. is there some good stuff we want to show here?
Yeah, so one of the things that we did here was we actually combined the previous health assessment deck had 2 different sections, and it's all the same information. Like, we didn't get rid of information, but we just kind of combined it so that the flow of the head to toe assessment also goes with the flow of information that we're providing you with. So we have, the whole deck is now one section, and it kind of just takes you through, like, from start to finish, what are the different components and everything like that. Vital signs are in here. All of the information you need for pain assessment is in here. Skin and nails. We put in information about the lesions, like skin lesions, the different types of primary and secondary lesions. We have a whole thing on cranial nerve assessment, because that is the stuff that gets people. It's just so tricky.
Yep.
So we have like cranial nerves 1 through 6. We've got a little chart here to help you remember, and then 7 through 12. And then we go through, we have our mnemonics to remember things, and we go through cranial nerve 1, cranial nerve 2, cranial nerve 3, so that you're never just like stuck and dealing. And then guess what? Cranial nerve 3, the card right after that, is 6 cardinal positions of gaze. That way you can remember that that's what I'm assessing with cranial nerve 3. 3, 4, and 6 make your eyes do tricks. Well, what does that mean? Cardinal positions of gaze. So we have a lot of great stuff in there to help you remember what goes with it and not just having that rote memorization. I also tried to add in some stuff that I thought was really important from my standpoint as an ER nurse. Things that you might see in that general survey, things you might see in that quick, brief assessment without even getting in depth. Talked some more about Glasgow Coma Scale, levels of orientation, stuff like that. We went a little bit more in depth there. So again, if you have Edition 2, that's awesome. There's nothing wrong with that information. There's nothing wrong with keeping those cards. They will serve you well. You can still watch the health assessment cram course and playlist when it is available without a problem. It just won't necessarily go in the exact same order, but it will have an overwhelming amount of the same information.
Totally. So let's get to our next winner. So our third winner is Hannah Castagna. Am I saying it? Castagna.
Yes.
Castagna. Hannah Castagna. I should just let Meris just pronounce all the names. That's kind of what I make her do most of the time anyway.
Hannah Castagna. Email us.
So congratulations, Hannah.
We will get you a flashcard deck of your choice.
Totally. Okay. Next up, we have Med-Surg. So
this is look at our that chunky guy.
Yeah, this is a chunky guy, right? So this deck, previously, if you purchased Med-Surg, it came in like 3 different volumes. It comes in one box now. It's one box. The information is sorted by body system, as you can see here. So Med-Surg, I love this deck so much, okay? This deck, each of the body systems has an anatomy and physiology review, because it's so important to understand how a body system is supposed to work so you can think critically about what might happen if something goes wrong with that body system. So every body system has an A&P review. The other thing that this deck covers is pathophysiology. So for us, we did not feel like it made sense to separate pathophysiology from medical surgical nursing, because honestly, there's just so much overlap. So each of the disorders in this Med-Surg deck has a description of the pathophysiology, and then goes into, risk, like a definition, the pathophysiology, risk factors, signs and symptoms, nursing care, patient teaching, treatment, all of that stuff. So, and again, we take out all the fluff so that you can focus on the most important stuff and the stuff that you are likely to get tested on. There's an index in the back. There's our Level Up RN learning system. If you have the previous version, again, this new one comes in a box. It's all together in one box. We did a little reorganization in the cardiovascular section, but honestly, that's the main thing that changed here. It's mostly the same thing. So this is our Med-Surg deck. And of course, we have an almost complete YouTube playlist. So I think I just have integumentary system videos to add in, which is the 10th body system. But that's the other great thing about our medical surgical nursing flashcard deck is you can follow along as you review the flashcards.
Yes. And don't,
All
a
right.
lot of you are saying in the comments, you're taking med surg coming up soon. This looks intimidating. Don't be intimidated. Remember that this is usually 2 to 3 classes worth of information. You're not going to be learning all of this in one class, but we did put it all together for you in one class. So you only have to buy it once and then you're good for at least several semesters.
Totally. And it's really all about grabbing a little chunk of flashcards, 20 flashcards, take them on a walk, take them with you in your little on the go box, right? That is what this is for. So you can kind of space out your studying and just, study a small amount of information and study that over multiple days, which is going to help you retain and learn the information so much better than like a big marathon 10, 12-hour studying session. You definitely don't want to do that when it comes to learning.
I love this comment that says, this stuff sounds so helpful for first year nursing too. 100,000%.
Oh yeah.
That lab values deck, ABG interpretation and EKG interpretation, med surg, whatever field, whatever specialty you go into. Yes, 110%. Super helpful. I used the flashcards all the time in my first year of practice so that I could get better at knowing what I was seeing.
Totally. All right. So who wants to win the next flashcard deck?
All right. Are you ready?
Yep.
Our next winner is Sarah Freyer. Sarah, hang on one second. I will copy paste this. Sarah, email support@leveluprn.com with your YouTube handle and which flashcard deck you want. Oh my gosh, you'll be in critical care step down. That's amazing. Oh,
that's
yay,
awesome.
Sarah's here. Okay, love it.
This is probably my favorite little graphic, actually, out of all the little graphics on the side. Like, how cute is that teddy bear? I don't know. What's your favorite?
This one is mine, but because it's so cute, but also because it's cute, I feel like they're tied for me.
Totally. Okay, so this is our pediatric nursing flashcards. And if you are not familiar with the different sections of the pediatric nursing flashcards, we have the principles of pediatric nursing. That's where we go into things like child safety, theoretical foundations, immunizations, that type of thing. And then the second section is normal growth and development. So that's where you find out like the normals for like physical growth, for psychosocial development, as well as those milestones like gross and fine milestones. And then the third section is disorders, and it's sorted by body system. So PEDS is not a class to take lightly or to underestimate. And people do at their own peril, really. I mean, we lost several people in my class to PEDS because PEDS is kind of like
hard. PEDS is low-key the hardest class in nursing school, in my opinion. Again, I always tell students what's hard for somebody else may not be hard for you. But similarly, everybody said pharm was hard. I thought pharm was like pretty straightforward. PEDS, I was like, what is happening? So I really needed help with PEDS. That was a struggle.
It's kind of like med surg all over again for little people, but also growth and development and theories and blah, 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 right? So it's just
everything you know is wrong.
Right. So give yourself some time with PEDS. These flashcards can totally help you. We have a video playlist. So these flashcards and the video playlist will help you conquer this class. So this is our PEDS deck. And how about another winner?
How about another winner? Yes, we do. One second. Oh, what did I do? Sorry, I hit a button. Email support@leveluprn.com. Okay, Zizao.
Okay.
Oh.
Zizao.
Kalele.
Oh,
email support@leveluprn.com. Don't worry, I already got back to her about that. And let them know which flashcard deck you want. Just confirm to us that you are here, so that way we know that you are for sure here. Zizao Kalele. Okay. Congratulations.
Totally. So for some of you who are just joining us, who maybe joined partway in before or after I told you guys how to enter our giveaway, if you want to enter our giveaway in the comments, and don't do that. If you've already entered, don't do this again, because I don't want you to be disqualified, okay? So if you've already entered, you don't need to do this. But if you joined late and have not entered yet, then in the comments, you can put Ultimate Nursing School Survival Kit. Ultimate Nursing School Survival Kit. You put that in there. We'll add you to the list of names because we have 6 more winners of individual decks. And Meris is still laughing at me for making people type all that stuff in the comments. They can do it. It's okay. All right. And so, yeah, if you showed up late and you didn't enter, go ahead and put that in the comments and Angelina will add you in there. Okay. Maternity. This is Meris's jam. This is why, okay, let me tell you this. People who get this deck and listen to her playlist, they crush it in maternity. Like, we played Maternity Nurse Squad the other day, and I forget who it was. I don't remember the name. I don't know if you remember the name, but somebody was like killing it, answering everything like, okay, wow. They're like, yeah, I have the cards and I listen to Meris's playlist. I don't know
she wasn't on my team either. I felt
I know she was on my team. It was amazing. It was amazing. I need to make sure she comes to every nurse squad. So, all right. So, sections of the maternity deck include preconception, pregnancy, labor and delivery, newborn care, and postpartum care. So,
yes.
And this deck contains some of the most beautiful and helpful illustrations, in my opinion.
Yeah,
yours
so much
too?
So that I have one up on the wall, which you can't even really see. Hang on, there it is. There's that one up there on the wall that I am obsessed with. I always felt that there was no text that did an appropriate job of showing you what fetal positioning looks like. What does it mean when a fetus is ROP or ROA? What does it mean if they're LOA, LOP, whatever that may be? That illustration is because I was fed up of not seeing an appropriate illustration. So we have that one. We have some amazing ones on where to put the fetal heart rate transducer when you are doing external fetal monitoring. There's the fetal station showing you what station 0 is versus -3, +3. Oh, yes. Yeah, we have an illustration about the difference between effacement and dilation. We have
Leopold maneuvers.
Leopold. Yep, exactly.
Yep. There's some super, super helpful illustrations. And this deck is just awesome about just getting you that core information and making it really clear and just really concise and really simple. And honestly, someone said, yeah, I got a level 3 on ATI thanks to the playlist and the cards. That is what we are all about. We want to help you on your ATI. We want to help you on HASI. We have helped so many students get a level 3 on their ATI, as well as students do so well on their HASI and, passing their NCLEX in 75 questions. So that is the goal, to help you do great on your exams, but also learn the key information you need to know for your practice as well.
Yes, and you can watch the entire maternity playlist. It is available both on the YouTube page and then also without ads on membership. And you can hear me tell you a lot of embarrassing anecdotes about when I was pregnant with my children. So hopefully that will help you on your test.
Okay, our 6th winner then is Audrey.
No last name. Very chic, very Madonna of you. I love it. So Audrey, email support@leveluprn.com to claim your flashcard deck. Yep, I love it.
Right?
Share. Okay. So Audrey, let me know that you're here so I can confirm for Angelina that you are present. Audrey.
All right, next up we have, sorry, I took the lid off prematurely so you can see. This is our funds deck. So if you are new in nursing school, but even if you're not, because honestly, the information in this deck is so important, not only in that first semester when you take fundamentals of nursing, but throughout your nursing program. When you get to your last semester and you're taking nursing leadership, guess what 80% of that content is? It's in fundamentals, which is why we have like a whole leadership section in fundamentals as well. This deck is so important for all your classes for the NCLEX. Definitely, if you're new and even if you're not new, this deck will help you learn and master those basics, that foundation that you definitely have to know in nursing school. So this deck contains how many sections? 6 sections. We got principles, we have practice and skills, gerontology, leadership, and community health. So this is not that big. Again, it comes with our learning system. It comes with an index. This is a super important deck. And Meris has a ton of fundamentals videos out there that you can listen to as you are studying this material. And I guarantee you that if you study these flashcards, listen to her, you're going to do so well on your nursing school exams and your proctored exams. And it's really going to help you set up a strong foundation for doing good throughout nursing school too.
And fundamentals, at least for me in particular, I felt like my NCLEX was 90% funds, and not necessarily that it was like legitimate fundamentals questions, but that most of the answers had to do with stuff that you learned in funds. Most of the answers for NCLEX have to do with patient safety, have to do with prioritization, that kind of a thing. So having a strong base in your fundamentals is really going to help you master NCLEX along with all of your other questions, because it's asking at the core, at the most basic fundamental level, what are you going to do to intervene? And that's why if you are not strong in funds, you might struggle everywhere else. So definitely be well prepared for that.
Totally. Okay. Do we have a number 7 winner? Maybe not yet.
Sure don't.
Sorry, sure. Okay, that's okay. That's right, Angelina. We'll talk about the next deck, which is psychiatric mental health, and then you can give us the next 2 winners. How about that? So, yes. Psychiatric mental health. This is also a super important deck because it doesn't really matter what area of nursing you're going to go into. You are going to encounter mental health issues. It doesn't matter. And so understanding the different disorders, the symptoms of those disorders, treatment of those disorders, etc., is going to serve you well no matter your intended path in nursing. So this deck contains 3 sections. We have principles, we have therapies, and we have disorders. So I'm the one who does the playlist for psychiatric mental health. And I also have a cram course for psychiatric mental health nursing as part of our site membership. So when you get your free membership when buying a flashcard deck, then you can watch my psychiatric mental health cram course. And if you have this deck and you watch the videos and stuff, you'll be in great shape for this course. Yes. And for your
exam. It's a very good thing that you have Cathy doing the cram course and the core content videos. She's so good at this. I am a nightmare when it comes to psych, so thank God for Cathy.
Yeah, I love teaching psych. I do. I really enjoy teaching it. And
wouldn't be me.
And then the next, okay, and this is the other one that I teach as well, which is
wait.
Oh,
We
have a winner. Sorry, I'm getting ahead of myself.
Okay, hang on. Let me do a little copy paste magic here. So Jerome Chouake and Sprite Clan. Sprite, I always feel such solidarity with you when you're on live and I'm always drinking a Sprite. So Jerome and Sprite Clan, both of you email support@leveluprn.com and let me know that you are here as well, so that I can confirm for Angelina. But you can pick the flashcard deck of your choice, and I'm so excited for you guys.
Totally. Congratulations. So that is our number 7, number 8 winner. Congrats. Definitely let us know in the chat that you're here, because you have to be here to win. Okay. And then nutrition is the next deck that we're going to review here. And the nutrition deck has 2 sections. It has foundations of nutrition and nutrition for nursing practice. So in the foundation section, you can find information on macronutrients, micronutrients, as well as food and, diet recommendations, and expectations as far as nutrition across the lifespan. And then in the second section, you can get nutritional recommendations for different disorders, such as dysphagia or, pancreatitis or, just all the different, like, heart disorders, et cetera. And it will give you nutritional recommendations for that. We do have a YouTube playlist that you can follow along with, and I'm getting ready to film a cram course for nutrition as well. That'll be part of our membership site. So this is our nutrition deck.
Look at that cute little carrot on there too. I love it so much. It's just like this cute,
that
adorable little
really
cartoonish.
Totally. Okay. Okay, not a winner yet, but that's fine. We'll go through the next deck, which is clinical skills. Okay. This is our clinical skills deck. I so wish I had this deck when I was in nursing school, because I used to make my own little flashcards that I would review before I went in to get tested on my skills, because skills checkoffs are like so stressful in nursing school. People are like crying. I vividly remember
shaking,
people losing their minds and crying and like, and it is nerve-wracking. I was super nervous. One of the things that really helped me is reviewing the janky flashcard I made at the time. These are super nice, but reviewing the steps before I went in there to test. So this deck contains the like step-by-step instructions for all of the core skills that you need to demonstrate in nursing school, as well as best practices for those skills. So it's nice and consolidated, so it's easy to review like in between classes and before you go in to get tested on your skills. So this is another awesome deck.
The little butterfly needle on the side is my favorite. It's so cute.
Totally.
See,
okay.
Hang on a second.
And then
wait.
It might.
We gotta give away.
Do we have more winners?
Yeah, Angelina's working on it right now. Because what we have.
I think she's working on.
Do we have one more deck? Is that it?
We have one more deck to go over.
Okay, let's just do that.
One more deck. Okay, so EKG interpretation. So this deck is a little bigger, right? And the reason why it's bigger, I think I taped it back. Yeah. The reason why it's bigger is because we've got all these like different rhythm strips for each of the arrhythmias. So the EKG deck is going to help you understand the different components of an EKG rhythm. It's going to help you understand the heart conduction system, and then it will help go through the steps to analyze an EKG, to interpret an EKG. And it goes through all of the different sinus rhythms, atrial rhythms, junctional rhythms, ventricular rhythms, as well as AV blocks. And for each of the dysrhythmias, it has like the rhythm strip here at the bottom. So it'll tell you what you can expect in terms of like the PR interval, the QRS complex, the heart rate, etc. And then it gives you an example down here of what that dysrhythmia looks like. So, and we do have a complete video playlist that kind of where I go through and explain what to look for, how to count boxes, how to interpret EKG. So this is important in nursing school. It's also really important when you get out of nursing school as well. So I know as a new grad on a med-surg floor, part of my job, like first thing, was getting the EKG results for my patients and putting my interpretation on there and the key information. They had me sit with the teletext to get all the information I needed. So really, this deck will really help you as a new grad, as well as helping you in nursing school too. So
yes, and I will tell you too that as an ER nurse, EKG interpretation is something that I have to do in real time all the time. Anytime I see something going funky on the monitor, but additionally, no matter where you work, if you work in an acute care setting in a hospital, I can almost guarantee you that you are going to have to take an EKG class and pass an EKG test, no matter what kind of a floor you work on. So if you are like, oh well, I'm pretty good, I got asystole, VFib, VTAC, and normal sinus, it's not good enough. They are going to ask you about junctional rhythms. They're going to ask you about blocks. You got to be able to be prepared. I used these exact cards, well, addition to prepare for my EKG test when I became an ER nurse. So definitely check these out for clinical practice as well.
Totally.
Okay.
Okay, we are caught up and we've got some more names of winners of individual decks.
Yep. So Denia Webb, CV, and Susan Scollins. And I'm about to put that in this chat here.
So Denia
Email.
Webb.
Yep.
Denia Webb, CD, and Susan Scollins. So those are our last 3 winners of the individual decks. So you can pick whichever flashcard deck you would like. Let support at leveluprn.com know which deck you would like.
Absolutely.
And then,
so excited for you guys.
Before we, so now this is the last chance. If any of you have just joined here recently, if you have not already entered, if you've already entered the giveaway, don't enter again because Angelina will toss your name out. You will get disqualified. But if you have not already entered the giveaway, you can do so right now for the last time. And you can do that by putting Ultimate Nursing School Survival Kit in the comments. So I'll say it again, Ultimate Nursing School Survival Kit. So if you just got here late and you're like, I want to win something, then you can do that. But if you've already entered previously, if you've been hanging out with us the whole time or most of the time, then don't do it again. Okay. Because I don't want to see anybody get
if you are here, Denia, if you're here, let me know in the comments so that I can confirm to Angelina that you are present.
So while we're waiting for Angelina to kind of compile these last few names and pick a winner, I want to make sure I answer, Meris and I answer any questions you have about the Ultimate Nursing School Survival Kit or any of the individual decks. Membership, we're happy to answer whatever questions you have.
About pricing. And so I figured maybe we could take this moment to talk about that.
Totally. So the Ultimate Nursing School Survival Kit is currently $369.95. That is over $100 off what it would be if you bought the individual decks. It is a significant savings, and it comes with free shipping. And if you are part of our membership, then you get an additional discount off of this product as well as all our other products. Yeah. And so I think I got everything right. And so the key difference for people who are curious about like the NCLEX pack and this contains all of the subjects that the NCLEX pack contained, but it also contains EKG as well as clinical skills. Those were not part of the old NCLEX pack. They are part of this Ultimate Nursing School Survival Kit. So there's really 2 additional subject areas included. And like I mentioned, free shipping. You get your little on-the-go box, which is super fun. And with the purchase of the kit or any of our flashcards, you get a free month of membership also.
So this says, Can I buy them individually? Absolutely, 110%. If you go to our website, and I will drop the link in the chat again, but if you go to our website, you can buy the whole kit. You can buy them individually. You can get 3 of them, 4 of them, whatever you want to do. And they do have prices for them individually as well. So if you're like, I just want maternity, great, we can get you maternity. If you want the whole thing, you can get the whole thing, and that will be available to you at a discount. This one is critical care in the med-surg deck. Yes. Yes. So it's not a section like critical care section within the deck, but what it is anytime there are critical care considerations for a med-surg disorder or what have you, we talk about what those considerations are, and you will see at the top of edition 3 that it'll say things like critical care on there, so that you'll know what like what we're talking about. Cathy will show you.
Yeah, I'll show you. And really, when it comes to critical care nursing, you're really learning some complications in critical care topics where it comes down to if things go more wrong, like you learn about disorders in med-surg, such as diabetes. And if a patient has a complication of diabetes, such as DKA or HHS, Those are critical care topics. But to really understand those topics, you really need to understand the underlying disorder, which is diabetes. This is why it really makes sense to combine these things into one deck versus having a critical care deck and a med-surg deck. It really makes sense to study those together because often those critical care topics are complications of disorders that you learn in med-surg. So, and let me see if I can find a card here quickly that shows it'll designate when there's a critical care
like
topic.
Pulmonary embolism, I think maybe has one, or
here's shock. Okay, here's shock, and it has like, I don't know if you can read that, complications.
So at the top right there,
care.
It says complications / critical care shock. And so that's where we're going to go more in depth into whatever. So that way, like this is a critical care concept. There's some confusion here about site membership versus YouTube membership. And I would love to clear that up really quickly. So the special discount that we're talking about, we need to come up with like maybe a better term or something. We're talking about site members. And if you'll let me really quickly, I will show you my screen here and let you see what exactly I'm talking about. So hang on here. All right. Can you see that? Okay. Okay, so the site membership is on our website, leveluprn.com. This has nothing to do with YouTube. You're going to click here where it says log in, and then that's where you're going to, shockingly, log in. And then that is the membership that we're talking about. Okay, well, disregard the fact that I need to update my my password account, apparently. But that's where you need to log in.
Totally. It is on our website, leveluprn.com. It is not the YouTube membership. It is our site, LevelUpRN membership. And that is where you can, if you're a member, you get discounts on all of our products.
Yes.
And now it's $10 a month.
Exactly. It's $10 a month to be a site member. You now have this special discount to save on the products. Now, we don't forget about our YouTube members. We do promotions for you guys all the time. They're different things. So site membership and YouTube membership are just different things. And so we interact with them at different frequencies with different promotions. So always keep an eye out on the community tab of our YouTube channel if you are a YouTube member as well. And then that way you can see whatever current promotions we may have for you there. So they're different things. I know that can be a little bit confusing there. So I'm so sorry. And I'm sorry that I couldn't actually show you membership.
And if you have any issues like on checkout or with discounts or whatever, if something is not working out, then definitely email support@leveluprn.com. So today we launched this whole new product line, like all of edition 3 stuff. So things are going pretty smoothly, but if there's any issues at all, we are super happy to help you. Support@leveluprn.com.
Yes.
And do you have an NCLEX product? Yeah. So all of this stuff in the kit is designed to help you with the NCLEX. That is like all of that information. That is the core stuff you need to know to do well on the NCLEX and on your other nursing school exams, as well as in practice. And let's see, taking the ATI fundamentals exam this quarter, any advice? Yeah, get these fundamentals flashcards and watch Meris's playlist and you will nail it. Okay. You will do great. We talked about the critical care thing. Yeah. If Level Up RN opened a nursing school, I would consider redoing nursing again. Love it. Yes.
Yeah. So the discount for this is available to site members. And what you need to do is just log into your membership, like go to leveluprn.com, log in there. And then once you are logged in, you can add anything to your cart and it should automatically apply that membership discount. But you have to be logged into membership for it to work. This has been hammered into my head by our marketing team.
Oh, yeah.
So I'm going to hammer it into your heads. You must be logged in to your site membership, your leveluprn.com site membership. Add things to your cart and then you will see a discount reflected. If not, double check that you're logged in and then email support@leveluprn.com. We have a winner.
And then someone asked, is this helpful even if my school doesn't use ATI? For sure. So ATI, HESI, Kaplan, UWorld, no matter what the testing platform is, they ask questions about the same core concepts and the same core information. So these flashcards will help you no matter what testing platform your school uses. And all right, we have a winner of the kit. So again, to show you all the stuff that our winner is going to win. That's 11 decks plus our little on the go box. And our kit comes in this amazing little storage container as well. So who is the winner of our kit tonight?
Are you ready? All right.
I'm ready.
Our winner is Memory Kasenje. Email support@leveluprn.com. Let us know that you are still physically present so that we can confirm for Angelina. And we will get you your kit in the mail. And yes, if you purchased previous decks between November 4th and now, email support@leveluprn.com and let them know. You guys can talk about what can be done for you. But oh my gosh, Memory, let me know that you're here. I'm so excited. I cannot wait to get this in your hands.
Totally.
This is going to be the best.
Yeah, totally. It's super cool. And then just so you guys know too, 2 other decks that are available on our website that aren't part of the nursing school kit include our medical terminology flashcard deck, which can really be helpful in nursing school, but definitely it's helpful before nursing school. It's also really helpful for other people in other healthcare professions or going to school for medical school or to be a physical therapist or other people like that. And then our wound care flashcard deck is another one that's on our website. And this is really great for new grads. So if you're getting ready to finish school and you want to get the key information you need to know to safely perform wound care and ostomy care for your patients, then definitely check out this flashcard deck. So those are 2 other decks that are available. And we have some super fans out there who are interested in buying all of our flashcards. We do have a package. It's called the Comprehensive Nursing Collection. It comes with all of our flashcards, all of our Nurse Squad games. So all 8 Nurse Squad games.
Yep.
As well as our dose calculation workbook and our tip of the day calendar. It comes with everything. So yes. So if you're interested in that, then check out the complete nursing collection on our website. So yes. Did our winner here, is Memory here?
She's here. Yep. She has confirmed that she is here. I'm very excited to get this off to her. Yay.
Totally. Yay. So congratulations to all our winners tonight. I hope this explanation was helpful. I hope you have a good feel for each of the decks and kind of what's included, what to expect.
How cute they look on your desk.
I know they really do. They really do. I need to, you know what? I feel like I really want to get a little shelf there.
Yeah, you should. Because it's great to show off the expensive papers, right? We love the expensive papers, all of them. But right, we also love the rainbow of products that we have that are so cute now.
Totally. Well, I know we went a little over, but we just had so much cool stuff to show you guys. And we really appreciate, all the comments, all the support. You guys had some really nice comments. We really appreciate that. And we love helping. We love these flashcards. We worked so hard to make these as perfect as possible. And we love teaching on the videos. And so we're here for you guys. Really, we're here to help you get through nursing school, to learn this stuff really effectively and go on and become a safe and happy nurse. Okay. So thank you so much for coming today. Hope you love this new edition as much as we do. And if you have any questions about anything, then definitely reach out to us at support@leveluprn.com. Okay.
Yes. Have a great rest of your day. And Happy New Year.
All right. Take care.
Bye, guys.
Bye.